Thanks so much, Deanna, for the warm welcome. And before I get started, just wanted to thank Deanna and all of the Acromegaly Canada team today. It's been a pleasure to receive the invitation and to present on behalf of Dr. Michael Cusimano today. I think it's really fantastic that we have so many people here today. It shows, a commitment not only to improving the lives of yourselves, but also the lives of those that will come after you. And that'll be a big theme, as you'll see in my BEAGLE presentation as well. I also want to thank our entire team that has put together the BEAGLE work so far, which includes Dr. Cusimano, a team of computer scientists, of UX designers, a lot of students and trainees. Et aussi bonjour à tout le monde en français. C'était un plaisir d'être là avec vous, surtout dans la belle ville de Montréal. Je crois que c'est incroyable que nous sommes tous là aujourd'hui pour m'aider à détecter l'acromégalie plus tôt qu'on le fait actuellement. Et je crois que nous avons beaucoup que nous pouvons faire pour améliorer et garantir l'équité et l'accessibilité aux ressources, surtout à nos communautés linguistiques au Canada. Et Diana m'a dit que c'est la première fois qu'on fait cette conférence aux deux langues. Alors, je suis vraiment excité et je suis heureux d'être là aussi avec vous aujourd'hui. Si vous avez des questions, ma présentation va être en anglais, mais si vous avez des questions, n'hésitez pas à venir de me parler après la présentation aussi. C'est vraiment un plaisir d'être là avec vous. Now as I get started, I want to share something that's maybe kind of on the top of your minds, which is this whole BEAGLE sort of name. Where did this kind of come from? So I'll start by actually sharing a bit of an anecdote from Dr. Cusimano. And if you're wondering where this BEAGLE came from, it's back to one story when he was actually crossing the border, and it was him and his mother-in-law. And so he's crossing the border, waiting in line at customs, and there was a small dog, not unlike the one that you kind of see up on the board over here, that kind of came up and started sniffing around and actually found something, right? And found actually that in his mother-in-law's backpack, there was sort of a meat sandwich. And so what this actually kind of symbolizes is, the dog was able to kind of sniff out or pick out something that no one else had been able to pick up yet. And that's kind of similar to what we want to do here with BEAGLE as well, is to try and actually sniff out acromegaly earlier than we currently do it. And so that's what I'm going to tell you about today with this BEAGLE project, is to try and pick out acromegaly so people can get that intervention and treatment earlier. And so this is who we are. So my name's Saif Rjaibi. So Saif just as in where you store your money. And I'm a research assistant with Dr. Michael Cusimano over the last 2 years. I'm also an MD PhD candidate at the University of Ottawa. And Dr. Cusimano has really led this study right from its inception. He's a neurosurgeon at St. Michael's Hospital. He does send his regrets for being unable to come here today. The hospital always has a crazy on-call schedule. I don't know how he does it, but he sends his regrets, but if there's one thing that will make him happy today is to have many more partners like you all today. So I'll show you exactly how you can get involved and help work towards this goal of earlier acromegaly detection. And so today I'll talk about two things. So the first part is, as you all know, is there's a very long time to diagnosis for acromegaly. How can we get that detected earlier? And the second is ways to get involved. So I'll tell you about two of those studies. There'll be a few QR codes and some URLs coming out, so you can get those phones out and ready for scanning when those are ready. And so I'll start by sharing a bit of a story. This is actually from one of Dr. Cusimano's patients, and he's been gracious enough to consent to us sharing a bit about his own personal journey with acromegaly, which is maybe not unlike many of the stories that we've kind of heard around these last 2 days. But this is him in 2004, and you'll see sequentially over the years. He started off by first developing a few symptoms like some sweating, snoring, and then it was some high blood pressure. He started to feel like things were kind of maybe a bit off, but the doctors kind of just told him, hey, let's just, treat the high blood pressure. Then it was diabetes, sort of the same thing. Let's just kind of treat the diabetes, medications, and then he was on kind of a whole boatload of medications, had carpal tunnel surgery. It was not until actually 14 to 15 years later when he actually developed a heart attack that they actually ended up discovering the disease. And so he had been stabilized, they took an MRI, identified the tumor, and he ended up getting operated on. But because the acromegaly disease was very much in an advanced stage, he needed to continue with some more medical therapy, radiation, and he's kind of stable now, but Had we been able to detect this earlier, then we could have prevented all those years of comorbidities and suffering. And this is maybe a story not unlike that you've heard kind of around the room, right? In acromegaly having a diagnosis time of, way over 10 years sometimes. And so this is really the challenge. And we know that when there's late diagnosis, this certainly drives worsened outcomes. And so this is a bit of work from one of our graduate students from our lab, Buster Milne, and it's essentially synthesized from other literature out there that when IGF-1 levels and growth hormones stay elevated, that this drives increased risk of morbidity and mortality. And so this really helps to go emphasize that we do need some earlier diagnosis. And so back to our patient again, right? What if we could have detected acromegaly earlier, right? Could we have helped our patient get earlier treatment? Could we have helped to improve the physical, emotional, and mental well-being, right? And could we have even reduced, even on the healthcare system, could we have reduced some of the burden of the disease and its comorbidities and constant doctor's visits and treatments, right? And so this is how we want you guys to get involved in helping us address this issue. And so I'm going to talk about the 2 ways you can get involved in our BEAGLE project. The first part is going to be with our BEAGLE diagnostic tool, so helping to develop that tool to be able to get earlier diagnosis. And then the second component is going to talk about how do we actually disseminate that into something that's going to be user-friendly and easily accessible. So let's talk about BEAGLE. I may not have actually wrote it out in full already, but BEAGLE is the key thing to remember, but it stands for Biometric Evaluative System for Acromegaly. And so it's essentially an app, and the goal here is really to detect the earliest possible changes associated with acromegaly and in turn hope to improve the quality of life. And so to accomplish this, we have kind of a vision, right? Is usually it kind of starts with, people like yourselves or others around the room, and you kind of feel like something is off, right? So maybe it's some of that sweating or that snoring or, early age onset diabetes or hypertension. And so in this case, right, is you really have an opportunity to now use this app and you upload a few images, say of your face, of your hands. You also help answer a questionnaire about different symptoms that you've had over the years, how long they've lasted, any treatment. And we essentially use this information to try and feed it into our algorithm, which is going to output a predictive risk for acromegaly. And depending on what the output score is, this is going to help to help give a recommendation, for example, if you should get some confirmatory diagnosis or seek out further medical consultation. And we know that also there's a lot of groups such as, Acromegaly Canada here, Acromegaly Community, who have a ton of resources, right? And so we're also thinking about, hearing this for the first time, right? It can definitely be a big shock, right? And so we want BEAGLE to also be a hub of support. And so kind of working with different groups to incorporate resources on how we can support patients who may be receiving some of this information. And so how can you participate? So here again is that first QR code that I was alluding to earlier. So all you have to do is really just take your phone out and then scan the QR code. So as you kind of hold up your phone up to the screen here, it should kind of pop up a link. And so you just kind of follow that link there, and that'll get you to the website. And then the website will have a few different information about the study, as well as how to participate, what you'll specifically need. Also get into that a bit more as well. And if you do participate as well too, if either you need an extra incentive, we do have Amazon gift card draws ongoing as well biannually. So you can always participate to join that as well. And as Deanna mentioned as well too, is we have a few study posters too. So if this didn't work out here, you can put it up again at the end, or there are also some study posters. You can see the link and QR code to get on that as well. Okay. And so in terms of who we're looking for participation is we're looking for a few different groups. So obviously if you've had acromegaly or gigantism in the past, again, it's currently or previously had. What we're looking for really is about just those pictures, so we can kind of study this disease longitudinally and identify those characteristics. Something else that we're also including in our study, which is not something that has been done quite often actually, is we're also including other control groups. So for example, if you've had a pituitary tumor other than acromegaly, that's also important because we want to try and identify whether having any type of pituitary tumor may also kind of lead to certain changes, and that will also help us identify, what are the acromegaly specific changes relative to having just any pituitary tumor. And so this is also another group, so maybe you may know, for example, others in your network. You can ask them to also participate as well. And also very, very important is family members. So as I put up in this, despicable me picture as well, right? We know there are certain features that, just run in the family, right? Like brothers grew and drew from Despicable Me. And so it's also very important to try and identify what are those features that may be caused by acromegaly and those that maybe just run in the family. So by having, your family members or blood relatives to participate, this is going to be very important in helping us develop a robust algorithm. And also, again, like if you want to participate actually, or get them to participate, all you have to do is when you're on that link that I put up earlier, there'll just be a small section that asks you that where you can invite them. And so you just have to, just write your own email and just click that checkbox. And then there's like no commitment at all, but you just kind of click that and then it'll send additional instructions to send an invite link to your family members. So that's really important. It's something we're hoping to build a lot more of as well. And so what you'll need to kind of participate, right, is just a few photos of your face, so at least a few over time. Hands and feet we're also incorporating into this model, and any document that shows that you have acromegaly or any other type of pituitary tumor. And so some of these photographs, what can they look like? So what our ideal ones are is, just anything kind of showing your face. Ideally, if it's, close up and your head and neck are visible and, you can have a face front on or side profile. But we also know that's not necessarily always realistic. Like most likely what you might have is maybe just, you guys just on the couch or in the living room. And that's totally okay as well. Like we can actually also work with that. It's just a bit pre-processing work on our end. But that's totally okay. If those are the pictures that you have, we can totally work with those too. And then in terms of hands and feet, again, these are some ideal pictures. They may or may not exist. So if you have others where the hands and feet are also visible, that's totally cool as well. And these are some examples here of what that might look like. And in terms of that document, right, we often get asked this a few times by some participants calling in. So this is just anything that has just shown a proof of your diagnosis. And so this is helpful for our study validity. And so this can include anything like pathology report or a consult note from your clinician, anything there, and you can just kind of download that, upload it, and then that's perfectly fine as well. Okay, so to kind of summarize that first part, so that first part of the study is really about developing this tool that is going to be able to help us identify acromegaly earlier. And now the second component of this whole BEAGLE project is now that, hopefully when we work on the tool being developed, then how do we actually disseminate and get that out to participants, right? How do we make it something that is going to be friendly to use, easy to use, and something that people are going to want to use? And so this is where the second component really comes in, and we're looking, again, for all of you guys for your insights as well and experiences. And so this is, again, a work that has been done by our team here, which includes myself, Melissa, who many of you have met as well, and some students as well with some UX design. And, we're focusing really on the packaging here. And so I'm going to show a bit of a small teaser just on some, I guess, initial work that's kind of been done. So let's just enjoy this for now. Okay, so just a bit of a teaser video there, and because I like upbeat music as well too, and maybe that's a bit more fun than just me speaking. So I guess where do we kind of go from here? So this is really fun, but I wish I could actually show, our entire pipeline where we're able to kind of do our whole screening and, give you guys kind of a sort of proof of concept in terms of risk prediction score. But unfortunately, what we do kind of need right now is, again, really more participation so that we're able to, develop something that is robust and that we can kind of be confident on when we do deliver that BEAGLE app, that this is something that is going to be robust and translatable to a lot of people around the world. So again, if you missed the chance earlier, we do really need a lot of participation in this. It's only going to be as good as the data that we do have. And so I do hope that we'll be able to kind of follow up in the future if we can get some more participation with, more, built off that previous teaser video, and we can kind of show a bit more there as well. So again, this is participation. We'll have some links. And so we've essentially done kind of on that design is we've kind of developed a bit of a structure and workflow through the app. So where people are going to navigate, here are kind of some resources, and we'll be kind of touching base with any of your insights as well. And on that note is we actually have a separate survey, which is actually related to that second component, right, which really focuses on that app dissemination piece. So it's thinking about, what are some of the challenges that maybe you guys have had in terms of using apps, right? How do we make sure that it's going to be user-friendly and accessible, right? Not everything that's out there is super intuitive to use, right? So if you do have thoughts on that, that would definitely be really appreciated. And those are things that we can kind of take into consideration when we're developing this app. And so kind of same thing here again, this is actually a separate QR code. It's to a SurveyMonkey. We also have a few study flyers just outside on the door over there. And again, this one is actually just a bit shorter. It's like 15 minutes or so, some of your initial thoughts, and it's definitely very much appreciated by our team. And so to kind of summarize here on the impact that we think we can do is, in this world, there's 1.3 billion people with hypertension, 463 million with diabetes, and 18 million deaths per year from cardiovascular disease. And so the idea here is, what if we could try and cure just a small fraction of these and pinpoint towards the cause of some of these conditions, right? And so that's where we think we can go with BEAGLE, right? Is what if through BEAGLE we could try and detect acromegaly earlier than it currently is and try and prevent some of these conditions from happening, right? What if through BEAGLE we could actually try and democratize access to a novel screening tool and actually put that autonomy in the hands of participants such as yourselves or everyone else around the world? And what if through BEAGLE we could actually provide that access to rural communities and low-income communities, right, which usually don't have as much access to endocrinology services, right? So what if through BEAGLE, right, we could kind of change the future? And so to kind of conclude here, it's been a pleasure presenting to you all today. If you guys want to get involved, I put up those QR codes again. If you guys are also clinicians as well, we definitely always look to get in touch, especially if you see patients and you want to kind of work with us as well on helping us develop this tool. Si vous êtes médecin ici et vous voyez des patients avec acromégalie, venir me voir aussi, ça serait un plaisir de collaborer ensemble. And if you have any questions, si vous avez des questions, you guys can always reach out to our team at AcromegalyResearch.ca. And with that, I want to thank you all for listening and taking the time to hear about BEAGLE.
Thank you very much. That was awesome. Has anybody got a question?
Not a question, just a comment. I was getting excited. When patients go to their doctor's office, right, we do blood pressure, we do vital signs, our mandatory vital signs, our heights, our weight. Have you thought of creating a compatible EMR version of this so that it's part of the software? Every time they come in, they get their blood pressure done, but they also get their hand and face. I think that would be a universal screen, and it just made me really excited. That's all. Great presentation.
Yeah, thanks so much for the comment. And that is something we are trying to work towards, right, is actually, getting this app right into the clinics, right, is so that way we, lots of people have shared with me their experiences over these last 2 days, right, and sometimes, you see your first family physician and, they might not know about it, right, so really getting it into the clinics and having it as an extra tool so that either patients can use or clinicians can use to get that first initial screen, right? And you have that first initial data point, and that may be help to, you know, get some future clinical examinations done as well too. So yeah, we're definitely very happy to share about that. Thanks.
Thank you, Saif. So 1 year ago, your colleague gave this presentation, and I was keen. I was like, I'm doing this. Sent it to my daughters. Nobody did it. Sits in my bedroom, right? I think as a group, we have to step up. Like earlier, we had to talk about what do we want to change about us. This is what we have to do, you know, do this, help you, because yeah, we're the only ones that can make a difference. Thank you.
Yeah, thanks so much, Vivian. We really appreciate it. And thanks so much for taking the time as well to fill out and share with your family members. Yeah. Yeah. Yeah, yeah. Yeah. Yeah, absolutely. Yeah. And that's what we hope to do is, you know, this is just kind of like, hopefully feels like not work, right? It's, you know, a fun, you know, hopefully way to, you know, go back into some of the record books and, you know, get some pictures together, and answer a few questions. We know it can be a bit long as well too sometimes, so that's why we're hoping to add, you know, those compensation and thank you for your time. But you know, hopefully, you know, the ultimate goal is really to help improve outcomes in the future, right? So for any patients, we know that there's a huge rate of underdiagnosis, right? So if we can hopefully try and cut that down, then we're hoping we'll be able to help improve people's lives in the future.
Thanks, Saif. That was really well presented. Patients will probably do it, but family members are always going to ask, what's in it for me? Maybe you want to include the amount on Amazon, or maybe open up Aritzia and Lululemon as choices. Yeah. And you might get a lot more people. Honestly, I know it sounds funny, but people are always going to ask, right, what's in it for me? And, you know, we do a lot of research at Mac and stuff, and there's always like, okay, will I get anything? You know, yeah, you're helping humanity, but they'll sort of just say, okay, whatever, right? Yeah. But maybe just the thought of maybe emphasizing. I know it sounds kind of, if you go to a CHE, or people always ask, is there going to be food there? Human beings, right? So just something to think about as a practical aspect. Yeah, thanks so much. So much of this project does involve and encompass those practical aspects as well too. So those are definitely good tips, and yeah, we'll bring them up to the team. I'm sure everyone's got their little something that they're, you know, going to be enticed by. So yeah, if you guys all have any thoughts on that too, then we're also happy to kind of collect that as feedback. Again, you can reach out to us either through that SurveyMonkey survey or through our email here as well. I'm definitely happy to try and figure out how we can get those other participants as well.
I'm going to make a draw out of this for all the patients or members in this room. You have 2 months to do the app. We're going to put, if you do the app, you got 2 months to do it. Get family involved, and all the people that do this app within the next 2 months, I'm going to put your name in a hat, and I'm going to draw one ticket, one name, and we will pay for your flight to come to the next conference, but you have to live in Canada.
Thanks so much, Deanna.
Oh, yeah. Any more questions? No? Okay.
Okay. Thanks so much, everyone.